Prediabetes, a path to prevention. 1 in 3 American adults will have diabetes in the year 2050 if diabetes trends continue. However, there is hope. People who lower their stress levels and choose healthy eating and exercise habits can reduce their risk of diabetes by more than 50%. During this presentation, we will discuss information about prediabetes. We will define it, explain the risk factors, discuss how and when to be screened, and review medication options. In addition, we will talk about healthy lifestyle changes you can make to prevent diabetes. Healthy lifestyle changes are physical activity, tobacco cessation, and weight loss. Prediabetes is a condition where blood glucose or sugar is higher than normal but does not meet the criteria for diabetes. About 86 million American adults have prediabetes. People develop prediabetes for a variety of reasons. First, the body's insulin may not be working well enough to maintain normal levels of glucose in the blood. Second, the cells in the body may not be able to use the insulin effectively. This is called insulin resistance. Finally, the pancreas may not be able to make the amount of insulin the body needs. In most cases, there are no signs or symptoms when a person develops prediabetes. Even so, some damage to the body may have already occurred. It's estimated that at the time of diagnosis, about 10 to 15% of people have signs of microvascular damage, including damage to the nerves, eyes, or kidneys. There are many risk factors with prediabetes, including family history, heart disease, and certain ethnic or racial backgrounds such as African American, American Indian, and Asian American. Other risk factors include the aging process, weight gain, inactive lifestyle, and changes in cholesterol values such as low HDL or high triglycerides. Medical conditions like high blood pressure, gestational diabetes, and obstructive sleep apnea increase prediabetes risk. Some medications such as long-term use of steroids and certain antipsychotic medications contribute to prediabetes risk too. Screening for prediabetes and/or diabetes is recommended for adults of all ages who are overweight, obese, or who have any risk factors mentioned earlier, whether they have symptoms or not. If you don't have any risk factors, you should be screened every 3 years starting at age 45. Screening is also important for children and adolescents who are overweight or obese and who have 2 or more risk factors for diabetes. There are 3 ways to screen for prediabetes. Your provider can check your hemoglobin A1C blood level, a fasting plasma glucose level, or they may ask you to take an oral glucose tolerance test. This test measures how your body reacts to sugar in your system by having you drink a glucose drink, then seeing your body's response by checking your blood glucose level. An A1C of 5.7 to 6.4% indicates prediabetes. Prediabetes can also be confirmed with a fasting plasma glucose between 100 to 125 milligrams per deciliter or 2-hour plasma glucose result of 140 to 199 milligrams per deciliter after taking the oral glucose tolerance test. Please note that an A1C less than 5.7% might still be a risk for prediabetes, depending on whether you have other risk factors. Talk to your provider to learn more about your personal risk factors. If you've worked hard at lifestyle changes for 3 to 6 months and there are no signs of improvement in your blood work, a medication might be needed. Your Care Here provider uses careful judgment as they weigh the risk and benefits for starting all medications. Because of the risk for damage inside the body, many providers choose to be more aggressive in managing prediabetes once it is diagnosed. Medications have been helpful in the treatment of prediabetes. The Diabetes Prevention Program study showed a 31% decrease in diabetes with the use of metformin. These individuals also had the additional benefit of mild to moderate weight loss and improvements in blood lipid levels. The STOP NIDDM study showed a 25% decrease in diabetes and improvements in heart health risk factors with the use of medication acarbose or Precosi. As mentioned earlier, you have the power to have the greatest impact on reducing your risk for prediabetes with healthy lifestyle changes of nutrition, physical activity, quitting tobacco, and stress management. In fact, the Diabetes Prevention Program study showed that patients can actually reduce their risk of getting diabetes by 58% when they changed only their lifestyle habits. Longer-term studies showed that health benefits remained even 10 years after the study ended. It is estimated that without weight loss and moderate physical activity, about 15 to 30% of people who have prediabetes will progress to full type 2 diabetes within 5 years. Now let's take a closer look at some of the lifestyle changes that will be helpful in reducing your risk for prediabetes. Scientists believe that there are two major reasons for insulin resistance: excess weight and physical inactivity. The American Diabetes Association recommends losing 5 to 10% of your current body weight, along with at least 30 minutes of moderate physical activity, like walking, 5 days per week. The most important part of weight loss is keeping it off. Think of choosing healthy habits that you can continue for a lifetime. Change can be one of the most empowering things in life. It can also be one of the most challenging. Life changes seem daunting when we initially think of them. Whatever the change may be, it is manageable when we take small steps. Small steps over time result in big results. Start small, stay consistent, and enjoy the journey. Improving your diet by incorporating a healthy eating pattern, like the Mediterranean diet, will help you meet your nutrition and weight loss goals. This meal pattern emphasizes fruit, vegetables, whole grains, lean proteins, and healthy sources of fat, like those found in omega-3 rich fish and nuts. It is also important to get enough quality sleep and to quit using tobacco products. The Healthy Plate method is another way to get started on your plan for healthy eating. Start with a dinner plate about 9 inches in diameter. Visualize a line down the middle of the plate. On one side, you divide it again so you will essentially have 3 sections on your plate. Notice the largest section of the plate is filled with non-starchy vegetables. In one of the small sections, you have your whole grain or starchy foods, and the remaining small section holds your protein choice. You may also add a serving of fruit or dairy 2 to 3 times daily or as your meal plan allows, and incorporate small amounts of healthy fats with your meals. The methods you use for cooking will also help you achieve your nutrition and weight loss goals. Try broiling, roasting, grilling, or stir fry with small amounts of oil. Choose heart-healthy fats such as nuts or seeds, olive or canola oil, avocado, or flax. When choosing starches, opt for more whole grains and fiber-rich selections like whole grain bread, oatmeal, unsweetened bran cereal, quinoa, whole wheat pasta, barley, or whole grain crackers. To reduce the overall saturated fat in your diet, consider trying meatless Mondays or opting for vegetarian meals a few times per week. Take time to rethink your drink. Choose water instead of pre-sweetened liquids or try infused water. Add a splash of 100% juice to your water or use a squeeze of citrus fruit. Lastly, limit your alcohol. Because every bite counts, consider choosing a more nutritious snack to fuel up between meals. Practice portion control by using the tips on this slide or the healthy plate method. Read food labels and ingredient lists to make wiser food choices. Opt for foods with less added sugar, more natural fiber, and healthy unsaturated fats. Reach out to your Care Here health coach who can assist you in creating healthy lifestyle changes that will last a lifetime. Besides changing your eating habits, physical activity and behavior changes can help you achieve a healthy weight. Before starting any exercise program, visit your provider to discuss plans and make sure it's safe for you to exercise. Once you've done this, just start moving. Ask coworkers to join you for a walk at break time. Track your progress. One of the most important tools you can use is a food and activity log. Whether you choose paper, pencil, or a smartphone app, tracking food, activity, and health habits will get you one step closer to preventing pre-diabetes. Your Care Here health coach will help you come up with your own personal plan for success. Get in tune with your body and your surroundings. Listen for true hunger and fullness signals and identify triggers for eating because of stress or boredom. In summary, first and foremost, do not delay screening. Discuss your test results with your provider and find out when repeat testing will be appropriate for you. You don't have to wait until you have an abnormal screening result. If you have any risk factors, now is the time to make changes. Remember, a lifestyle intervention approach is your primary key to prevention. Don't hesitate to seek the help and support of others. Lastly, the internet can be full of confusing and conflicting information. Friends and family may not have the latest information and recommend changes that are not right for you. Always rely on evidence-based resources to continue your learning and stay up to date. Examples of these resources are listed on this slide.